Okay, we are going to go over the objectives that are going to be for the shoulder and its evaluation. I'm going to be checking the elevation or the depression of the shoulder tips. So when I'm looking at my patient, I want to check to see, are the tips of the shoulder, do they look equal? Okay, I am squatted down just a little bit. Okay, do they look equal inside? Equal on both sides. So I'm going to put my index fingers on both, check to see they do look like they are at the same level. Mind you, the dominant hand of your athlete is going to already have a lower shoulder, but if he has more of an issue, so raise that shoulder just a little bit, raise this one a little higher. This would be more of an obvious asymmetric when it comes to where their shoulder tips are, okay? Versus when he's relaxed, this right shoulder is going to be slightly lower, but it's not going to be low enough that it needs to be an indicator that there's something wrong. Okay, I'm also going to check the position and the shape of their clavicle. So he does have a shirt on, but if he didn't have a shirt, you can look at the clavicle to see how it looks. And are they equal? Does one go a little higher than the other? His left one does just a little bit. Does it depress the same? He actually depresses more on the left than the right. And then do they all both end at the same time? Okay, you want to check to see, do the clavicles look the same? The acromion process. Okay, the acromion process, again, it's at the tip of the shoulder. Do we want to, we're checking to see if one is elevated higher than the other. Both of his acromion process are at the same height, so we're good on that. Okay, I'm also going to check his postural assessment. So I'm going to look at my patient from the side, and I want to check to see, does he have kyphosis? So does he have the rounding of the upper back like a hunchback? Does he have lordosis, where it looks like he has a Beyonce butt? Okay, or is he very flat back? Because that's another thing too. One other thing that you can look at when you're looking at them from in front is, do their shoulders round forward, or do their shoulders pinch backwards, or are they neutral? Okay, that's what we're looking at as far as positioning, because that does give us indicators as far as whether they may or may not have a shoulder injury. Okay, the position of his head and his hands. So have you take your hands out of your pocket, please? How he positions his head. Does he position his head where is it straight? Does he tip his head to the left or to the right? And where is his hand placement? He does have his hands slightly forward, which is actually more of a neutral position for most people. Okay, if their shoulders are really rounded forward, they're going to be very far in front. If they pinch your shoulders back, they're probably going to be more at their sides. Okay, I'm going to have you turn around, please. So face that way. Thank you. I'm going to check to see with their scapular elevation and symmetry. So scapular elevation is where they shrug the shoulders. So have you shrugged your shoulders? Okay. I know he has a shirt on, but you're checking to see, does the shoulder blades, do the scapulas, do they elevate at the same height? Okay, go ahead and relax. Okay. And are they symmetrical in the sense of, does one go higher than the other too quickly? Or are they going at the same time and coming down at the same time? Also, I'm going to look at protraction and winging. If he didn't have his shirt on, you can definitely tell he's got a little bit of winging going on. I can stick my fingers behind his shoulder blades, okay? That's not exactly a good thing. But then also, you can ask them to pinch his shoulder blades together. So retraction, a little too much, but it's okay. But he can retract and they go equally together. Okay, relax, okay?